Triage means option A prioritizing, option B assessing, option C planning, option D evaluating. The correct answer is option A prioritizing. Triage is the process of sorting patients based on their need for immediate medical treatment. In triage system there are 4 color codes: red, yellow, green and black. The red tag indicates the patient need immediate treatment. The yellow tag denotes the patient need urgent treatment. The patient with significant injury but can tolerate a delay in care. The green color denotes the delayed treatment. The patient have some minor injury can safely wait for treatment. The black color denotes the patient is spared. While performing Helmick maneuver on a conscious adult patient, the rescuer delivers inward and upward thrust specifically. Option A above the umbilicus, option B at the level of xiphoid process, option C over the victim's mid-umbilical area, option D below the xiphoid process and above the umbilicus. The correct answer is option D below the xiphoid process and above the umbilicus. Common manifestation of acute left ventricular failure is option A dependent edema, option B dyspnea and cough with frothy sputum, option C increased urine output, option D sudden loss of consciousness. The correct answer is option B dyspnea and cough with frothy sputum. Left atrium receive venous return from lung. The left ventricle failed to pump blood in the systemic circulation. There is increase in end diastolic volume and left atrium is unable to maintain venous reception from the lungs. Hence there is a pulmonary congestion. This pulmonary congestion leads to impaired air exchange and cause cyanosis. Increased pressure in the pulmonary vein produce pulmonary edema and cause cough with frothy sputum and nocturnal dyspnea. Angiography dye contains option A iodine, option C iron, option B sodium, option D titanium. The correct answer is option A iodine. Ideal position to prevent aspiration during nasogastric tube feeding is option A sideline position, option B head and 30-degree elevated, option C head down position, option D supine position. The correct answer is option B head and 30-degree elevated. A typical side effect of statin is option A myopathy, option B glioma, option C tremor, option D nasal congestion. The correct answer is option A myopathy. Statins are otherwise known as cholesterol lowering drugs. Statins lower cholesterol level by slowing production of cholesterol and by increasing the liver ability to remove low density lipoprotein and increase high density lipoproteins. Atorvastatin and fluvastatin are example of statin drug. Side effect of statins: myopathy, vomiting, stomach cramps, brown discolored urine, diarrhea, joint pain and increased liver enzymes. The route of transmission of MRSA is option A sharing of instruments, option B blood transfusion, option C reuse of disposable items, option D hand carriage. The correct answer is option D hand carriage. Methicillin resistant Staphylococcus aureus is transmitted through Skin to skin contact. When a child is admitted with diarrhea, the nurse has to anticipate dehydration and option A, urinary retention, option B, pulmonary congestion, option C, hyperactive reflexes, option D, electrolyte imbalance. The correct answer is option D, electrolyte imbalance. Patient on anticoagulant drugs reports bleeding gum, black tarry stools. It is a manifestation of option A, drug resistance, option B, drug sensitivity, option C, irregular intake of prescribed dose, option D, drug overdose. The correct answer is option D, drug overdose. Drug overdose is the injection or application of drugs in quantities much greater than recommended dose.